welcome to the HIPAA Road to Compliance webinar presented to you by Kurosh Compliance Solutions. My name is Amy Holliday, and I will be your presenter today. I am one of the analysts and project managers for Kurosh Compliance Solutions, and I am joining you from Augusta, Georgia today. After years of frustration at the provider level concerning all of the misinformation about HIPAA, I joined the Kurosh team and achieved certification in healthcare privacy and security from HIPAA. And my goal now is to help other people make sense out of the complex subject of true HIPAA compliance. Roger Schindel is the CEO of Kurosh Compliance Solutions, and he's active at the federal and the state levels of many associations related to health information management, as you can see in this slide, and all of our project personnel are certified from a variety of well-recognized organizations such as HIMSS and HIPAA. So prior to 2012, Kurosh was conducting a variety of different trainings and webinars, mostly in the healthcare field, but at the request of one of our clients, we developed current iteration of HIPAA exclusive consulting and training. We specialize in HIPAA compliance for small to medium-sized entities, and while we have the ability to work with clients in any area of the country, our current locations are in Indiana, Illinois, Iowa, and here in Georgia. Our clients come to us from the public sector and the private sector. We have sole practitioners, just very small practices, all the way up to medium-sized, large locations that have several locations with their organization. We work with county health departments and jails and mental health regions. As a matter of fact, we're equipped to handle the unique needs of behavioral health providers, as well as doctors, dentists, and chiropractors, and all of the other areas that you think about with HIPAA. But a lot of our clients are also organizations that would be considered business associates that handle, store, transmit, or destroy the protected health information from a provider. And as what you'll learn today, the business associates are mandated by these same HIPAA regs as those that provide direct patient care. So as I mentioned earlier, my goal for today is going to be to help you understand what true compliance is, how to tell if you're compliant, and also to help you understand how to build the HIPAA compliance program for your organization that will meet regulatory scrutiny. So we're going to use a tool called our HIPAA Diagnostic today to help you determine the status of your training, your risk assessments, your remediation plans, and to help you correct any deficiencies. So we have a tool. I'll download that in just a second. Let me do this slide real quick first. As this slide demonstrates, everything in this slide is what is needed for proper HIPAA risk management, and it has to be part of a dynamic process with training and awareness at the core. HIPAA regulations require that we do risk assessments, and these risk assessments need to create a remediation plan, and from that remediation plan we know what deficiencies that need to be addressed, and from there we can train our staff related to all of these areas. So today we're going to do a deep dive into each of these components, and we'll show you how they build a HIPAA compliance program only when they're implemented as a continuum. So as I mentioned, we'll be utilizing our HIPAA Diagnostic, and this was developed on published guidance from audit protocols and resolution agreements from the Department of Health and Human Services, commonly referred to as HHS. So we will frequently mention HHS and the Office for Civil Rights because the Office for Civil Rights is the enforcement arm of HHS, because it is a civil right to have your protected health information protected. Right now I'm going to stop for a second and go and share the HIPAA Diagnostic for you if you want to follow along. You can look up in your file share icon and it should be there for you. If you have any problems with that, let us know, and we can share it for you again. You can also just follow along with us if you don't want to download that while we're going, and you can also find the HIPAA Diagnostic at our website at caroche.com. So, in the HIPAA Diagnostic, and this is again based on the published guidance from HHS, they put out information about upcoming audits and the instructions that they will give the auditors. They also publish resolution agreements when there have been breaches, and most of the time the resolution agreement, it will spell out what the organization needs to do to correct, and a lot of it always involves training and education for staff, and then they also put out a lot of published guidance just in general for providers. So today what we're going to do to begin the deep dive is we're going to look at HIPAA policies and procedures for your organization to determine if they're up to date, effective, and available. And those, it looks like a very simple sentence, and oh yes, we have HIPAA policies and procedures, but it's packed with a lot of information to be able to demonstrate that they're up to date, effective, and available.